So I'm Misty Allen. I'm the Suicide Prevention Coordinator for the state of Nevada. I've been doing this work since the late 90s. So I've seen Nevada through a lot of change when it comes to mental health and suicide prevention. And I've been doing this work for 20 years because I believe in it and it works. And the more people we can have feeling comfortable with this conversation and having the tools to reach out and support people, the safer our communities and schools will be. We're going to look at the statistics really briefly, have a quick check on the Nevada Suicide Prevention Plan so you know our vision, risk factors and invitations for help, protective factors and resources, and really just hoping we can improve your comfortability with the topic. So the Suicide Prevention Plan, COVID threw this off, and so we're a year late. Our last plan was the 15th to the 2015 to 2019, so we're still in draft form. But a few months ago, the National Surgeon General's call to action for suicide prevention came out. And we really believe in the new vision. What we're doing right now isn't working. Suicide rates have increased about 36% since 1999. And we have to figure out better and different ways to do this. So you'll see all the big vision. It is a big vision, but we want to do better data and surveillance. So we have many bills in the legislative session right now to help possibly start collecting more timely suicide ideation and attempt data. We really want this to be a caring community circumstance. Everyone does have a role to play in suicide prevention, and we want to help people find that role, whether it's professional, in their community, in your school. Just being there for your family members when they might need safety and support. I lost goal 3. I don't know where that went. But goal 4, support adoption of evidence-based practices for suicide safer care. There's a lot around zero suicide. Healthcare systems and behavioral healthcare systems we're focusing on. And that will also be enhancing crisis care and care transitions. If you haven't heard Crisis Now, we are working on our community-wide, statewide crisis system of support. So that would look like mobile crisis, the crisis call center hotline becoming like an airport air traffic control hub, and they will know where there's open beds to send people so they're not waiting in waiting rooms in emergency departments. And then those care transitions, when they are coming into the system with mobile crisis and when they're leaving healthcare or inpatient services, we want to make sure that pathway of support is out there in the community to keep them safe and within their families and friends support system. So really big one there. 6 is develop a robust workforce. So this would be trainings. We have continuing education, as you know, for about 9 different boards. We have mandated CEUs and CMEs for physicians and nursing and most mental health clinicians. So we want to keep developing that, reach out to mining and construction and other workforce, farming, keep growing that, but continue to build and find trainings as well. Now, a lot of people in your district have seen me way too many times. We want to keep it fresh and support new trainers as they get into this, new training topics as we learn more, like trauma is big, as you know already. And then lethal means safety, absolutely a discussion we constantly have. And this is one you can have with your students and families, locking up those medications and firearms. And we'll talk about that towards the end. And then finally, the suicide postvention. Typically, we have postvention for survivors of loss, bereavement to suicide. We have support groups, virtual or face-to-face. But we also want to build a postvention plan after someone has been admitted for a suicide attempt or multiple attempts. And what that would look like is developing a program where we have a team come to the hospital, reach out to that family or that support system. So when that person leaves the hospital or inpatient care, they are in a safe place with people helping them work their safety plan. It's really effective. We don't have that happening right now. And then also our first ever Northern Nevada Survivors of Suicide Attempt Support Group is starting this month. I think it might be starting soon with Rise Wellness. So they are trying to develop a suicide prevention resource center for all types of clinical and prevention efforts. So big visions, and hopefully I know you'll all be a part of this. Washoe County is a big part of the work we do. A lot of where we're heading, as I told you, what we're doing doesn't work. We really have to rethink what suicide prevention looks like. And what you see here is from a vital signs report. You often hear about mental health issues being a part of this. Absolutely, that has a piece to play. But we also have to think about the environment, whether it's the greater community environment, the culture, or even our home environment and what's safe. So these are really important community efforts and policy changes we need to make at the higher levels. Every increase in minimum wage will decrease suicide risks. There's research to show that. So how do we strengthen our economic supports? Housing is crucial. So basically, if you think about it, Maslow's hierarchy of needs, we have to have that baseline of safety first built before we think about that prevention with suicide. It's really crucial. This is what wears and tears on our mental wellness. So suicide statistics just came out for 2019. 47,511 people took their lives in the United States. That's like a jetliner full of humans crashing every single day of the year. And those are the ones we know about. Firearms are a big part of this. Nationwide, just about half use firearms, very accessible and incredibly lethal. It's the 10th leading cause of death for our nation, where homicide is 16th. Second leading cause of death for ages 15 to 24. Males take their life more often than females, and every 11 minutes, there's a suicide in the United States. Pretty shocking. For Nevada, we have the 7th highest suicide rate for 2019. We have been out of the top 10 only twice. We hit 11 in 2015 and 2017, and then we came back in. The Intermountain West, we'll talk about, has the highest rates in the nation, and we lost 642 Nevadans. It is the leading cause of death for our youth, ages 12 to 19. We're not the only state that has that. It's in many of our neighboring states as well, leading cause of death. Our elderly have the second highest, and we typically have the highest in the nation for our elders over 65. And as I mentioned, we have more suicide deaths than homicides and car crashes combined.
I had a quick question. Sorry to interrupt.
Yes.
Why is Nevada the
please.
7th in leading suicide rates? I mean, what factors do we have that other states do not have that contribute to this?
Great question. So on this map, as you can see, Nevada is the only white state. In 2018, there was a report where I told you the national rate has increased 36%. Some states have gone up 50% since 1999. Nevada is the only state that decreased by 1%. We're never that success story on this map. But I will give the disclaimer that it's because we had one of the highest rates to start with. For many, many years, we had the highest rate until about 2001 when we started to move. So if you look at Montana, Idaho, Wyoming, that Intermountain West, those are the top 10 typically. And what do you see when you look at that map? What do you think about with the Intermountain West? Anyone can answer that. We have a nice small group.
They're rural states for the most part.
Absolutely. And with ruralness comes isolation, lack of resources. Our workforce is incredibly hard to get out there. In Nevada overall, we have a shortage of workforce for health in general and mental health especially. But think about our smaller rural communities. High access to firearms. Stigma is still tremendous out there for mental health, addiction, and suicide. There's some research where altitude and oxygen can be a part of this. I wonder, high altitudes, ski resorts have high risk for suicide, and it's really complex. The thing about suicide is it's never one thing. It is a multi-dimensional issue, and so are the risk factors, the reasons for Nevada. Some people think it's the weather, but look at Nevada, Arizona, New Mexico have incredibly beautiful weather. Washington and Oregon have lower rates sometimes. So it's complex. Faith can be a protective factor, but Utah has high rates and they have a strong faith community. So does that help a little bit answer that question? Okay.
Yes,
thank you.
For
our youth, okay, thank you, Doctor. For our youth, ages 0 to 17, as you might be aware, COVID really impacted our youth. Right before COVID hit, Washington County had a lot of loss. Literally right before spring break, we were preparing. It wasn't all by suicide death, but still lots of grief and loss. And then COVID hit and things quieted down there. Suicide rates did decrease. Anxiety, depression, isolation increased tremendously, but suicide rates decreased. Then around August, November, as school was coming back in, Clark County had a spike between September, October, a short amount of time with a lot of youth suicide. That put a spotlight on Nevada. Washington, New York Times, CNN had stories, lots of talk and upsetness. But as you can see in 2020, that wasn't one of our biggest years. And when we look at spikes, we really have to pay attention to, are there connections? Was there a link by school, link by internet? Was there a link by contagion, something in the community? And we couldn't find that. So more resources, lots of incredible things